Welcome back. Welcome back to rpay.org, which stands for Reimbursement Premium Adjusted Yields. Yes. Folks, consumers have been ignored for too long in healthcare. Ron Bachman, the actuarial, has written a book on unlocking the secrets of health insurance premiums. Yes. I will briefly go over who the main stakeholders are. Main stakeholders in healthcare consensus that balances the needs for all the consumers. If you really look into it, who are the main stakeholders, you may ask? All right, let's look at number one. Number one, consumers. Consumers want a coverage for pre-existing conditions. Pre-existing conditions, they want increased choice and improved quality and lower premiums. That's what they want. They want lower premiums. Consumers, to begin with, have been ignored all along. So who are the number two stakeholders? Who are the next stakeholder? Who are the stakeholders? Uninsured, yes. Uninsured, the reason why they are uninsured, we need to get to the fact why they are uninsured. First of all, they can't afford it, or they have lost their job, or they are going to in transition, whatever the reason may be. Maybe they are impaired and they will not be able to get the insurance coverage what they need. So uninsured want guaranteed access to affordable coverage. They want guaranteed access. So uninsured are the second stakeholder. Who is next? Hospitals. Yes. Hospitals, they're providing uncompensated care. As a result, hospitals are losing money and they're not able to provide the care for the uninsured. So we want to minimize uncompensated care by the hospitals. How do you minimize it? That's the thing which we're going to talk about. There is a way to minimize it, folks, but we need to minimize the hospital care, uncompensated care, yes. Number four, doctors. Doctors are the big stakeholders. Doctors want tort reform because they practice defensive medicine. There are unnecessary tests being done, unnecessary screening tests are done just to protect themselves. So they want a tort reform and they want a liability damages to be lowered. So that way, they don't hit with big lawsuits. Basically, tort reform is to lessen defensive medicine, which will lower the cost, yes. So that was number four. Who are the next big stakeholders? None other than insurers. See, insurers. Insurers want stabilized private insurance market. That's what they want. And expand client sales and product offerings. That's what they want to do, but they need to work with the consumers. It has to be consumer friendly, which they're not. Insurers, we need a reform, especially among the insurers. The reason being they are not segmenting the risk, and they're not lowering the premiums, and they're not even trying to lower the cost of the healthcare. So insurers are the big stakeholders. That was number 5. Number 6, employers. Employers, what do employers want? They want affordable group health insurance for their employees. You see, employers want affordable group health insurance rates for all their employees. And the last but not the least is brokers, agents and brokers. First of all, this so-called agents or brokers look for commissions, obviously. Instead of having agents and brokers, they should be liaisons between the consumer and the insurance. They should be educating the consumers in obtaining a consumer-driven healthcare. And they will also their responsibility should be to take care of the people who can't take care of themselves. So I don't mind having them getting commissions as long as they provide the service to the consumer. So these are the main stakeholders, folks. These are the main stakeholders in healthcare. So we will go into detail how this personalized health insurance works. But these are the main stakeholders which I will be addressing one by one, how we can improve the quality of the care and affordable care at the right price. So the prices have to be transparent, and there has to be more competition. There has to be. We need to try to avoid having middlemen between the insurers and the consumers. There's no reason to have it. These middle level organizations like managed care, billers, and medical groups, their overhead is 15%, folks, each. So medical groups have 15% overhead. Health, so-called managed care, they have 15 to 20% overhead. And billers have 15 to 20. See, these costs are being ultimately the costs are being paid by the consumers. So consumers want to minimize the cost. Only way you can do is get rid of these mid-level organizations. Thank you for listening, and we'll talk about this public-private partnership instead of a government-run healthcare or private-run healthcare. Ideally, it should be in between. It should be a public-private partnership, and there should be a health review authority. Their goal is to take care of the people who can't take care of themselves. Yes, who can't take care of themselves. Folks, thank you for listening. We will see you in the next segment. Goodbye and God bless.